Senator Roberts. Thank you, Senator Canavan.
Thank you, Chair. Thank you for being here. Can you tell me how many medicines have been approved under the provisional approval pathway during the COVID period, 1st of July 20 to date, please? My numbers are 13 vaccines and 6 drugs. Is that correct?
Sorry, thank you, Senator. Are you talking specifically about COVID treatments and COVID vaccines?
No. Just any vaccines, any drugs that have been approved using the provisional pathway.
I will start with COVID vaccines or treatments. There's been 7 COVID vaccines and 8 COVID treatments. I'll just check whether I've got the numbers for other medicines during that period, Senator. So you're talking about the provisional approval pathway.
Yes.
So, okay. So from the 1st of July this year, there's been 5 provisional approvals. From the period 1st of July 2021 to 30th of June 2022, there's been 23. That would include those COVID treatments, but what it does show is there's a lot of other medicines, such as cancer medicines, such as medicines for rare conditions, that are also approved. In financial year 2021, so from 1st of June 2021 to 1st of July 2021 to 30th of June 2022, there were 5. So over the period you're talking about, that would add up to 33.
Thank you. How many drugs have been approved under the normal process during that same period? Just a number.
During the same period, I will add the 3 financial years, and I'll check my mental arithmetic. 36 this current financial year, 117. These are either new approvals or new indications approved, and 95 the year before. So it is a percentage of them, a significant percentage, but not most of them.
Thank you. Is the maximum provisional approval period 6 years? Because it can take that long to get a drug approval under the old approval system.
So a provisional approval is only valid for 2 years, and then the company either has to come back and show why they cannot obtain all the data within that period and apply for an extension.
Is the maximum provisional approval?
For a further lots of 2 years.
Is the maximum provisional approval?
So overall, the maximum period is 6 years, but it's not 6 years off the bat.
Thank you.
Written in law, but it's 2 years
Thank
off
you.
the bat.
It's 2 years with extensions. How much money do you
with possible extensions? They're not guaranteed, Senator.
How much money do you save pharmaceutical companies by switching from full approval to express approval? I understand it's hundreds of millions per approval.
It actually costs the pharmaceutical companies more in regulatory fees for provisional approvals.
No, I didn't say regulatory fees. How much are you saving there? How much are you saving the pharmaceutical companies by giving them express approval or provisional approval rather than going through the 6-year period of getting proper approval?
It's not a 6-year... No, you've misinterpreted the system. It's not a 6-year period to get full regulatory approval, Senator.
It varies. I accept that.
A company can put in most of our approvals are submitted straight as to a standard approval, especially, for example, if it wasn't a public health emergency or it's a drug that already has other ones in the same category. They're submitted as a standard approval.
So what I'm talking about is if they have to do dedicated trials for their drugs, how much, because I understand that can be hundreds of millions of dollars.
Senator,
how much time would they save? How much money would they save by going express?
We would not give a provisional approval to a medicine unless if there were clinical trials.
How much money does it save? How much money does it save doing if they do a provisional without doing a formal normal approval process? How much money does it save a drug company?
I don't believe there's necessarily savings. The situation will be different in every drug, but it's really important to emphasise there were very extensive clinical trials for the vaccines and treatments that have been through provisional approval.
My understanding is that it can cost hundreds of millions of dollars to get the full approval process in tests. Without the dedicated trials, they can save hundreds of millions of dollars per drug.
I don't necessarily agree with you, Senator.
Okay. When does the provisional approval for Pfizer expire?
So the 2-year period will be 2 years from the anniversary of the first approval. I would emphasise that in certain countries,
so what is that date?
The products are now fully approved.
What is the date of provisional approval expiring?
Okay, the very first approval for 16 years and over, the 2-year period finishes on the 25th of January 2023.
Thank you. Is this the approval process for the I've got here in front of me a document called the Australian Public Assessment Report for Tozinamerin from Community Pfizer, December 2021. Is this the approval application for the paediatric version of the Pfizer vaccine?
No, it is not. What an Australian Public Assessment Report is, it's a summary of the assessment that we did of the application. The actual application, and you mentioned Pfizer, is over 220,000 pages of paper for Pfizer for that particular group of vaccines.
Thank you. Can I reference page 61 under, quote, limitations of the current application data? It says, and I quote this, safety follow-up is currently limited to median 2.4 months post-dose 2 in cohort 1 and 2.4 weeks for the safety expansion cohort, end of quote. What is the safety expansion cohort?
Okay, so remember also this was going back at the time of approval. We now have hundreds of millions, actually more than 1 billion people who have been vaccinated with that vaccine, and experience going on since December 2020 when the first vaccination was done. The safety expansion cohort is in a clinical trial where individuals are monitored closely and the data reported back to regulators for periods of months leading to years after their vaccination.
Thank you. Did you recommend this substance then based on 2.4 weeks of safety testing, or did you get more in? And if so, over what period? How many months?
No, so remember the initial approval from TGA was based on that 2 months of follow-up, but we also had the experience of other countries that had more than a month before started mass vaccination campaigns. So when we approved Pfizer on the 25th of January 21, we were in almost daily contact with the British, who by that stage had vaccinated some millions of British people by 25th of January 2021. So real-world evidence played a very important role in both the approvals and in the ongoing safety monitoring of these vaccines. So
you relied on data from other countries, and you relied for periods of months, merely months. So it can't be more than 6 months because there's a gap between application and approval, and to give time for collection of data and analysis. So this should be years of data before we start putting this kind of stuff into our children. Yet it's months.
I disagree in the context of a pandemic and a public health crisis. Regulators globally felt that it was appropriate to do initial approvals.
You're the Australian regulator.
Several months, David.
You're the Australian regulator.
Yes, and so as the head of the Australian regulator, I would do precisely the same if I had my time again. The alternative would have been to leave Australians unvaccinated through the course of 2020, 2021 and 2022. And there would have been tens of thousands of more Australian deaths, Senator.
Can I then reference a letter from the Commonwealth Department of Health signed by Radha Kiani, Director, Governance and Coordination Section, in which the department makes this claim. It's this letter here on the 4th of November 2022, just last week. Quote, a large team of technical and clinical experts at the TGA carefully evaluate the data submitted by the sponsor. A treatment or vaccine is only provisionally approved if this rigorous process is completed. This document concerned the use of Pfizer stage 2-3 clinical trial data in support of their application for provisional approval. Did the TGA check the stage 2, stage 3 clinical trial data from Pfizer? Did you check it?
We did check the phase 2 and phase 3 clinical trial from data from Pfizer, and we also took it to independent external medical experts as well as consumer representatives.
Thank you. Referencing Freedom of Information number 2289, in which the applicant requested a copy of the stage 2, stage 3 clinical trial data, and the TGA responded, quote, the TGA does not hold any relevant documents relating to the request. End quote. And that was the request for stage 2, 3 clinical data, trial data.
I believe, without seeing what's in your hand, I believe that you asked for individual patient data rather than the phase 2 and phase 3 clinical trial data. I can give you my word that we assessed the phase 2, phase 3 clinical trial data. Otherwise, what else did we do? Look at the colour of the label on the bottle. That is the main thing our team of several dozen clinicians look at in reviewing a new vaccine. The phase 2 and phase 3 clinical trial data, it is a centrepiece, Senator.
The Freedom of Information request then asks for, quote, any documents confirming the process of analysing this data to produce a decision, including meetings, notes, dates and times, end of quote. And again, the TGA replied, we have no relevant documents. That's a quote. Did you review the stage 2 or 3 data or not? And if you did, why did you tell this Freedom of Information applicant you did not have these documents? Which document is the lie? One of them is.
Senator, I don't have that document in front of me, so the FOI, so it's not really, we can review it on notice, but we reviewed the phase 2 and phase 3 clinical trial data at length.
Senator Roberts, this really needs to be the last one so I can share the call, please.
So I just want you to think about this, and confirm it or otherwise. And the trial data contains sufficient proof the vaccines were safe and effective, sufficient to meet the criteria for provisional approval. Is that correct?
Correct. Yes.
Thank you very much,
Thank you,
Chair.
Senator Roberts. Senator